Thank you for speaking with me today. February 28th marks Rare Disease Day, and there's a new research update for a fatal orphan lung disease. Idiopathic pulmonary fibrosis, or IPF, causes permanent scarring of the lungs and difficulty breathing. This research update reveals that there are quite a few shortcomings in the area of awareness and support for IPF patients and caregivers. Joining me to share insights on the emotional impact of IPF is pulmonologist Dr. Jeffrey Swigris, along with IPF patient John Marthanos. Good morning. Thank you for speaking with me today.
Good morning.
Thank you for having us.
Now, please share with us exactly what idiopathic pulmonary fibrosis, or IPF, is.
IPF, or idiopathic pulmonary fibrosis, is a scarring disease of the lung. It causes difficulty getting oxygen into the bloodstream, and this leaves patients short of breath. And as the disease progresses, patients become increasingly short of breath, doing even minimal physical activity. It's a really devastating disease, and 50% of patients will die within 5 years of being given this diagnosis. And although we consider it a rare disease or orphan disease, it's actually not all that uncommon. It's estimated to affect over 130,000 people in the United States.
Oh, wow, that really is interesting. Now, a new survey about IPF was recently conducted. Can you tell us what were the findings of the survey?
Sure. This survey of 100 patients with IPF and their caregivers, conducted in conjunction with Boehringer Ingelheim, showed us that, as we'll hear in John's story, the road to diagnosis is often a long and circuitous one. Patients are often misdiagnosed with other ailments before the correct diagnosis of IPF is given. And as you can imagine, this leads to an incredible frustration and anxiety in patients and their loved ones. Most importantly, the survey results told us that patients are really screaming for education about this disease and really needing support. They want to know more about the disease before they go into the doctor's office and are told you have IPF, and that's the first time that they've heard of it. And their caregivers, who do such an amazing job caring for patients, also need a support network, because they can get burned out and run down in their job, in their role as caregivers. Both of those parties, patients and caregivers, feel like we as a medical community need to do a better job with a disease management plan, sort of a comprehensive partnership with the patient, letting them know that, hey, we know about this disease, there are things that we can do to help you, and there are support systems out there.
Yes, absolutely. Now, who took part in the survey? You mentioned some people. Was there an advisory committee of IPF experts as well?
There was. So the respondents were patients and caregivers, 100 each. But the advisory committee was made up of physicians, nurses who help take care of IPF patients, and I think most importantly and uniquely, John, an IPF patient, what I consider the real expert of this disease, was there on the committee to help shape the questions and help interpret and now disseminate the results.
Now, based on those survey findings, has there been a recommendation by the survey advisory committee?
Yeah, the advisory committee suggested a couple of things. One is we need to develop support systems for not only for patients, but also for caregivers. Two is that patients, we urge you, if you're having shortness of breath and your doc can't figure it out, get to a center that's comfortable at least investigating IPF. And three, a call to the medical community out there to make yourselves aware that IPF is a disease that you're likely to see in your practice, but you're not going to diagnose it unless you think about it.
Yes, absolutely. Now, John, you are an IPF patient, and you're also were on this Advisory Committee. Please share your story.
Basically, my story centers around, I thought I was having a heart attack. My doctor saw something on my lung, which was not related to IPF at the time, but it still rose a red flag, and he monitored my progress or failings. After approximately 4 years, I was becoming short of breath, just walking to the beach, walking upstairs, and he sent me to pulmonologist and gastroenterologist to see if there was something going on, GERD, or did I have a lung disease? And they all came back that I was either obese, allergic to cats, or asthmatic. Meanwhile, the disease was getting worse and worse. I found myself being able to do less, found my skin losing its glow and turning grayish, and doing simple tasks like screwing in a light bulb, tying my shoelaces, I'd be winded. It would just, I couldn't breathe, I was gasping for air. Finally, my doctor sent me to a cardiologist who tested me and said I had a very strong heart, and I asked him, why can't I breathe? He listened, and then he sent me to a university center. He sent me to Yale, and they did the same test the other pulmonologists did, and they told me at the end of the day, John, you have two options. One is you could allow yourself to die in 2 years, or you can go on a list and see if you qualify for a lung transplant. And from there, I went to New York Presbyterian Hospital, enrolled in the program, and finally, I qualified for a lung transplant. And to qualify is not like being the smartest guy in class. It meant that you were the sickest guy in class. My left lung was almost non-functional. So I was put on the lung transplant program list in July, and I was very fortunate. I'm one of the few that did get a lung transplant in September, and that was 2.5 years ago. And all I could say is during that time, and this again goes back to the survey, my wife was a phenomenal support because she had to screw in the light bulbs that I couldn't. She had to take out the garbage. But she was also alone, and she was watching me really just shrivel away, and she had nobody that could really understand what she was going through. And that's why there's such a need for support.
Yes, wow, what an amazing story, and thank you for sharing that with us. So please tell us, where can people go to, or first tell us more about Rare Disease Day and why it's important for the IPF community.
Rare Disease Day is on February 28th, and it is a day that calls attention to all too commonly forgotten diseases like IPF. Right? It's a day to realize that there are people out there who have been misdiagnosed or given an alternate diagnosis, but really have one of these rarer diseases. And they're out there suffering and in need of education and support and help. And our hope is that on February 28th and all the days thereafter, that IPF is on people's minds as a potential diagnosis and a disease in need of more research and attention.
Yes, indeed. And where can people go for more information?
They can go to the web and go to lungsandyou.com. That's lungs and ANDU, all one word. And there they'll find information on IPF. They'll see the results of the survey, and then also links to other reputable sites that will help people understand what they're going through and what their family's going through.
Okay. Well, just remember that, like you said, February 28th is Rare Disease Day. I want to encourage all of my followers to learn more about rare diseases such as IPF and what they can do to help their loved ones and caregivers have the support they need. And again, be sure to visit lungsandyou.com to get more information about idiopathic pulmonary fibrosis. Thank you so much, you two, for speaking with me today.
Thank you.
Thank you, Makiba.
Thank you. Have a great day.